All right, next up, we will have Step One Foods. Step One Foods is a local CPG company that is also participating in our Bold Growth cohort this year. They have medically tailored foods to help with cholesterol lowering. And so today their challenge will be discussing how to infiltrate the elusive insurance system and getting those things qualified. And to do that, we have Dr. Elizabeth Klodos and Bill.
Hi, everyone. Great to be here. So before we get to the actual pitch, I thought I'd give you a background a little bit about why we're here and why we're asking this. So as a cardiologist, what I can tell you is the way we treat heart disease makes no sense, right? And you've probably experienced this yourself. High cholesterol, here's a pill. High blood pressure, here's 2 pills, without ever addressing why the cholesterol blood pressure is high in the first place, right? And the result is this: waiting rooms full of people with perfect numbers, but imperfect health. No cures, just a never-ending revolving door of follow-up visits. This is not why I went to medical school. Okay? But it only dawned on me as to why I was failing when I started asking people what they ate. And it became instantly obvious, right? It's like, duh, no wonder there's 94 million Americans with high cholesterol. Those medications actually have to work really, really hard. So if you sort of step back and kind of look at what my options are, it's educate or give medications, right? And so I did education. I went out and I said, like, oh my gosh, no patient is trying to eat poorly on purpose. They just don't know what to do. I deployed dietitians. I gave out cookbooks. I spent hours counseling patients. The people that followed my advice, it was amazing. Medications list shrank, diagnoses melted away. I was curing people for the very first time. The problem, I could count those successes on one hand. Changing diet is really hard. But the lesson is there. If a condition is caused in part or in whole by food, the answer is change the food, right? Change the food. So but it's not really about just slapping on another, check mark or heart label on a food, right? It's really rethinking what we're doing. It is creating foods that are specifically designed to affect a measurable health outcome, right? So this is food, but it is dosed and testable like drugs. And that is what Step One Foods is. It is a pioneer in the medically tailored foods space. Okay. And we've done something that no other company has done. Our measurable effect is lowering cholesterol with 2 doses of our food and in 30 days. And we tested that hypothesis with Mayo Clinic and University of Manitoba, subjecting our approach to the highest level of scientific scrutiny, a randomized controlled clinical trial. And what we found is that in 30 days, doing nothing but adding 2 doses of Step One Foods per day and changing nothing else in a free living population resulted in a 9% reduction in LDL or bad cholesterol. Some people had medication level, Lipitor level results. And that's really great because a lot of people can't even tolerate Lipitor. Now you might say 9%, big deal. Well, if I reduce the average LDL of the US population by 9%, I will finally dethrone heart disease as the #1 killer of Americans. It's a huge, huge effect. And if you look at it more broadly, right now, today, we are spending $450 billion treating heart disease. We are on our way to spending $1 trillion in 15 years. This is unsustainable. We can solve this by using food as medicine.
Okay, the ask. So this is the audience participation portion of the pitch here. So I assume, I make the assumption here that probably everybody here, likely most people get their health insurance through their employer who's in the food and ag industry. How many people in your health insurance have food that is reimbursable for a diet-driven disease? Anybody? Probably none. And we're the leaders. We think that's a huge problem. Almost every innovation in healthcare starts with a self-insured employer or an innovative insurer who pilots that and then proves the business case for that new procedure, technology in healthcare, and then others adopt. We are the leaders in healthcare, or leaders in ag, food and ag, not just in Minnesota, but in the world here. We need to lead. And it's not just a problem, it's an opportunity. We talk about, I mean, the pharmaceutical industry is one of the few industries that rivals ag in terms of size. And this is a space that food should be playing in. Food can be medicine. And if we buy into that, this represents maybe one of the ultimate new uses for ag. So the question, the problem we're posing to this group is, why doesn't your health insurance plan cover food for conditions that it can help with? If it were to include, to pay for some of those foods, what would the criteria be for that? What would be the requirements? And lastly, would your employer, would your insurer consider being one of those innovators to pilot food truly part of it? So we would love to hear your insights.